I watch how the training goes, and I keep telling dentists, if you spent a day in a hygiene program and watched this, not only the acumen, but the level of stress, if you saw how hygiene students strive to be the very best they can be every day, you'd feel confident having them there all the time. Hygienists go through this program, they really get grilled the entire 2 years. And then when they finally leave, there's almost like this letdown. Like, I went to all this education, I went to all this training, and all I do all day long is the same thing every day. And there's no challenge left, but anesthesia provides that challenge. Like, you got to walk down two sides of the street. You've got to know every drug you use in the practice of hygiene and dentistry, because it can impact systemic health, but at the same time, you got to know every drug that people use for their systemic health, because it may have an impact on dentistry and hygiene.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor Business Media production. This is episode number 405. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. We have a great lineup for you over the next 8 weeks or so. Amazing guests, a lot of energy. Most of these were recorded at the American Dental Association SmileCon conference. And today is the beginning of those awesome episodes. So for this week, we have on Misty Mattingly and Tom Viola. And the bigger message that we have here that we're trying to talk about is the fact that local anesthesia is safe. But these rule makers, these people who are in power, they make the laws in certain states, they want to position the ability to anesthetize a patient as serious as life or death. Like, if a hygienist was to possibly give anyone some sort of injection, they're probably going to kill them. And it's just so ridiculous. And so Misty is on because she has done some amazing work with the Georgia Dental Board in getting some legislation passed to allow dental hygienists to do local anesthesia. So we want to hear about her journey, not so much like the opposition part of it, but more along the lines of what is the requirement, how are they going to fulfill and train the hygienist to be able to be competent enough to do these things for both themselves, but also to satisfy what these legislators want. So that's interesting of Misty's journey. Then we have Tom Viola on. He is, of course, our go-to expert when it comes to anything pharmacology. And so he's giving his opinions on the different matters that are related to drug interactions and safety measures. So truly a great episode. So fun to record at SmileCon. And then next week, we have Misty back as co-host. And that's a theme that you're going to feel over the next couple of months. And we bring on Teresa Duncan. Teresa Duncan, as you know, has been on the show before. And we talk about what is and isn't appropriate relationship statuses at dental offices. Oddly, they have not been following much of the drama that's been unfolding with a certain Texas dentist. And so we talk a lot about his antics. I'm trying to fill them in on kind of what has been going on. And we're taking a look at what the fallout is and what it could be, what lessons we can learn about friendships in the office, about our employer-employee relationships, all of that stuff. So be sure to come back for that one next week. And then in a couple of weeks, just as an aside, I will be attending the Perio Protect conference down in Scottsdale. This is my third year in a row. I love this conference. This is truly, for small conferences, one of the best evidence-based scientific conferences that you'll ever find. I took a look at their lineup. Amazing courses, great speakers. So if you have the time, I know it's probably a late start for most of you to attend in person, but I believe they have remote attendance options as well. So if you have the time, head over to providers.perioprotect.com/product/2023. Now, I know that's kind of a long, kind of a different URL. So if you can't remember it, I'm putting it in the show notes. So all you have to do is click on the title of this episode, usually in your podcast app, and there'll be some show notes, and you can click through if you wanted to register for that one. It'll be really, really good. That's for all of you science nerds. Like, this is the one. You'll really enjoy it. And then for 2023, I think that might be the last conference. There's a great chance I'll be at Greater New York Dental Meeting. I've been there for, I think, 7 years in a row or 6 years in a row or something like that. So I might be there for a couple of days. It just kind of depends on if I line up enough interviews for that time. So if you're going to be there, let me know, because I would love to meet up. And there's tons of events that are going on all the time for that meeting. So there's definitely different places that we can hang out. I think that's all for me for this week. Thank you so much for listening, and please enjoy this episode with Tom and Misty.
A tale of two hygienists.
We're talking about all sorts of good stuff. I'm just going to start recording. But it's just like, it's the same thing with traveling. Like, you've traveled all over the world too. Misty, you've traveled a lot too. Like,
Yeah.
you open up your mind when you travel to new ideas, new people, new foods, new, cultures, like the way they do things. I don't think my dad listens to this program anymore. I used to listen like every single episode. So Dad, if you're listening, let me know if you hate this. But he and I went to Panama one time. We went to Costa Rica. We got on a bus that was going to go to Panama, and it was a 14-hour thing. On the ride home, a guy got on in Panama and gave, in Spanish, like we didn't really understand most of it, but was giving some health tips, like, hey, be careful with the water, be careful, make sure you wash your hands when you use the restroom in this bus and stuff like that. And when you get off and have some food, make sure it's cooked all the way through or it's prepackaged. And then at the end of that, he walked up and down the aisles and people were giving him money. And my dad was like, for what? Like, why are we giving him money? And I'm like, honestly, Dad, I don't know why, but I'm going to give him money because everyone else is, and you don't want to be the person that is misunderstanding the culture.
When in Rome. Yep.
Exactly.
Yeah.
And so like the great advice that I might have cut it off, but like the great advice of going to the conferences, subscribing to the magazine, thank you, listening to the podcast,
Yes, sir.
is going to broaden their horizons, not going to keep them with that biblical, like, this is what my first office did. This is like gospel. We have to do this, nothing else. Otherwise, we're going to get reported to the board.
That's exactly right.
So
Can't say that so many times. Yep. Same thing.
The voices you hear, Tom, Viola, welcome back to the show. Thank you very much.
Thank you.
Misty
Thank
Mattingly
you.
is here with us as well.
Misty,
Yes,
nice to meet you.
Nice.
Man, this is going to be a great episode. I'm really excited because the topic of local anesthesia is never ending. I was telling you before the show, I just got asked a question in one of the forums again, and multiple repeat follow-up questions based on my answer. Local anesthesia is never going away for understanding and comprehension.
Right.
And you're one of the foremost experts on this, so thank you very much for being here. Misty, also foremost expert on this for hygiene. I mean, you've done some incredible things. You want to tell the audience what you've done?
Well, I mean, I've worked really hard on getting local anesthesia for Georgia. I've helped even Mississippi and a little bit even with Texas, helping them write their rules and so forth. And, hygienists have been able to do anesthesia in the United States for over 50 years. And the fact that we're still having this thing they can't do it or they're going to kill somebody, it's really insane. And if you look at the history of anesthesia, there's really hygienists, there's not claims against hygienists for killing anybody. There's not, and that's not even something that even dentists have. Dentists don't even kill people with local anesthesia. So the fact that it's even brought up that a hygienist is going to do it, it's where does that come from? What are we really scared about? Because that's the thing I don't understand. And, what the fear really is, and I think that we never really get to it, is the fear is that the doctor might be losing control and that they're not in control of that situation. But they still are, right? Because they're the ones that allow the hygienist to be able to do it. They're the ones that are going to be comfortable with that hygienist, doing local anesthesia. I partnered with teacher Tina RDH. You know her?
We love
Yeah.
Tina. She's been on the
Tina.
podcast
I
too.
love
Yeah.
Tina,
Yeah.
Tina,
She's
Tina,
great.
Tina,
She's
Tina.
great.
She is amazing. She's a great educator, because we just passed and got, local anesthesia in Georgia.
Yeah.
And so we have to have great educators come into the state and educate our hygienist on it. And I really wanted, teacher Tina, RDH.
It's hard not to say just Tina, right?
I
It's
know.
Teacher Tina.
It is hard. You have to be like Teacher Tina. It is kind of weird. You don't want to call her that in person, but I every time I talk about her, I'm always like Teacher Tina.
She'll love that.
But I really wanted it also to be hygienist, teaching hygienist, and
Yes.
then also we're also making it a part where we're inviting the doctors to be a part of that education piece of their hygienist and providing them free CE.
Right.
So they'll get 30 hours of free CE for being part of the hands-on piece. So then they can also be a part of that education, because sometimes I don't think the doctors know the education of the hygienist, because honestly, the clinical standards for Georgia that we put in place for hygienists is actually more hours than the dentists get in dental school. And
Yep.
and we have to pass at 80%.
Yes.
You know, in college, it's what, 70?
75%. typically.
75, right?
That's right.
So
yes.
we're saying they have to do it 80. So we even made the standards even higher
Yes.
for the hygienist to be able to do anesthesia than for the doctors. So I hope that we'll have doctors that will really participate, and so that they can see that. And I think, honestly, Tina will do a great job even teaching them some new techniques and stuff, because I think
Absolutely.
all of us can continue to learn. And I think, I don't know, I'm really excited about this in Georgia. I'm really excited to see us get going. I'm saddened that we don't have more people like ready for it, right? Because I think, but also I feel like for so long that they've been held back, you know,
Yep.
that they're hesitant to really get going. Does that kind of make sense?
It sure does. I was involved in the rollout of anesthesia for hygienists in New Jersey and Pennsylvania. And I did the pharmacology portion of the training in those two states for, I don't know, thousands of hygienists. And even though I wasn't a big part of the clinical apparatus that brought the hygienist in and had them do the actual injections, just teaching them the theory, the one thing that I noticed was missing was it was hygienists teaching hygienists, which was amazing, and I loved it, but there were no doctors there.
Right.
Because I think if they were there and had seen the stringent process, the requirements, that the way the faculty worked so well and so hard to make sure that it was the very best technique, I think that would have built a lot more confidence in the docs, and they would have said, hey, wow, I feel confident having my hygienist undergo this training because I now have confidence in him or her being able to perform well in my operatory.
And that's exactly what we're looking for. And so that's why we're offering, we want the doctors to be a part of coming in to educate their hygienist, because I think that's going to be eye-opening to them when they get to see the level of education. Because for
Yes.
some reason, our education is always downplayed, hygiene education.
Yeah.
And I think that's because a lot of dentists don't understand what the training is all about with hygiene, because a lot of them are not hygienists. They didn't undergo hygiene training. But I always give them that perspective because I'm the outsider looking in as the pharmacist. So I watch how the training goes, and I keep telling dentists, if you spent a day in a hygiene program and watched not only the acumen, but the level of stress, if you saw how hygiene students strive to be the very best they can be every day, you'd feel confident in having them there all the time. Because, and that's where supervision comes in. Some states allow the doc not to be there and have the hygienists practice under general supervision. If I saw my hygienist undergoing that kind of training, I'd be 100% confident knowing that they can handle things without my presence there. Again, if the state allows it. Now, the opposite of that is some docs don't know and will say, well, since I don't know, I'm going to assume it's the worst. And I get that, because I think anybody would if they're not familiar
Agreed.
with it. And so I think that's education.
I think there's a lot of education. And then, too, I think that, a lot of it is also the fact that they think that we just have like this 2-year degree, right? But they also forget that, and a lot of programs now are turned into bachelor programs,
Yes.
right? Because in all honesty, it should probably be a bachelor's.
Oh, yeah.
Agreed?
But, but even though you only got a 2-year degree, right? I mean, I went back and completed my bachelor's. But, I also went to school 2 years before I could even enter hygiene school, because you have to do,
Exactly.
and everybody forgets about
Yeah.
the fact that they had to do chemistry and pharmacology
Yes.
and all of those things, just like a nurse does.
Exactly.
But yet we don't get that same respect. And I really hope that allowing hygienists to do local anesthesia in every state creates that common ground too across the country, and hopefully that will encourage that level of respect to go up.
Yeah.
Especially really in Georgia, I really hope to see that, because as you said in our last podcast, the two scrapers, and I hate that.
Yep.
Because we're oral healthcare providers, and there should be this partnership between doctors and hygienists to care for our patients comprehensively and to help each other out, because I'm a big proponent, we win and lose together as a team,
absolutely.
right? And I really think we have to have more of that harmonious, community in this hygiene. And I really hope that local anesthesia will help that. And I hope, this program with Teacher Tina and having the doctors come in, that'll be the start of, maybe a change.
Well, name me one other profession other than nursing where you come in basically with absolutely no skills in dentistry whatsoever. You're a complete novice, but yet and somehow in 2 years you have to pick up an instrument that you've never held in your hand before and be able to work on a live patient with that instrument and perform so well that you can pass a peer-reviewed exam at the end of those 2 years, having never had it in your hand to begin with 2 years ago. And if that's not enough, then also understand all of the academics, the pharmacology, and all those other courses you have to take. Tell me what other profession gets that all done in 2 years.
Oh, it's so intense. I lost my pen. You'll see here it's like missing from on my lapel, one of these. That was my hygiene school pen. And I lost it this week, and it always means something to me to wear it.
Saw your post
You
about
saw my
that.
post. I was so
right.
sad. And yeah, you see it?
Yeah.
I wear it always. And one of my hygiene sisters from hygiene school, because I had posted, she was like, I don't know what I did with that pen, but I probably have it, and doesn't mean anything to me. She was like,
Wow.
And I told her, I said, but it should. And I also said, like, that was the hardest thing I've ever done. Like, go into hygiene school because everything
Yes.
is so, like, right? It's a lot.
tests your mettle. It
It's
does.
intense,
Yes,
2 years.
absolutely.
Right? Because you're
Yep.
cramming a lot
Oh,
into that
I-
education.
First thing I do in my course is when I start teaching pharmacology, because it's one of the more difficult courses, and I say, okay, how many of you have cried
Oh,
in
we've
this
all.
program? And they all raise their hand, like, I've cried at least once. Yeah, I'm like, it's only September. You've cried already? You're like,
And you're like, if you haven't yet, I'm going to make you cry. No, just kidding.
wait till I tell you have to memorize the top 100 drugs. You're not going to be so happy about that. You may cry. But that's the point. If anybody knew what hygienists go through, that's why I always say that same thing. Give me another profession that could do that level of stress and apply that to a person who, let's face it, isn't ready for it. You really have nothing to guide you. You have no way of knowing what hygiene school is going to be like until you're already thrust into it.
Oh,
The interesting thing about that, though, is like all of these, I would say movements or whatever of let's make hygiene school easier. Let's make, the exams easier. Let's do all of these things really frustrates me because to what you're doing in Georgia, the 80%, which is 5% higher than what the standard is, I like that it's hard to be a hygienist. I like that
Absolutely.
it's hard to get through. I like that not everybody passes. When you have your student group and then you're between 1 and maybe like 3 years, out of school, that little 5-year span, all of them probably have a similar opinion. Like, that was unnecessarily hard. We shouldn't have had to do that, blah,
Agreed.
blah, blah. But now you look at us, and we're like, no, you're our colleague. We need you to be coming out of school prepared.
Top shelf.
We are going
Top
to
shelf.
be not fighting with the doctors, but some of the dental boards don't play nice. You guys sound like you just play nice in Georgia, at least. A lot of other ones don't. Hygienists, doctors are not on the same page. But if we can go back and say, no, look how difficult this was. We have objective evidence to say
Yes.
we are qualified. But if we start dumbing that down,
well, that's my fear.
Oh,
and
my
that's
gosh,
why I
yep.
think we should do more. And I also think, like even when people have talked about like getting rid of boards, because a lot of like on the medical side, right? A lot of doctors, they don't have to take like a board,
Right.
To actually get their license and things like that we do in dentistry. And I think that really gives us that gold standard, right? That everybody has a standard, because if you're at a school in Florida versus a school in Mississippi versus a school in New Jersey, you're going to be taught different.
Mm-hmm.
But I think that it really provides that continuity of that education, and really like they need to have an exam. And I appreciate the fact that we have a national board
Mm-hmm.
and that we have a clinical exam. So I always say, we're double board certified.
Yeah.
Right? We
Well,
are,
yeah.
yeah,
Well,
hygienists. Like,
Isn't Alabama a state where you don't have to attend a hygiene school to be a hygienist?
Preceptorship.
Yeah, you can do
Preceptorship, right?
preceptorship in Alabama, but you have to work with a doctor for 2 years. The doctor would educate you, and I believe you still have to pass the board.
Okay.
But,
Yeah.
but my question, I'm not sure about that one. But like,
maybe not,
But at the same
but-
point, though, is like, are these doctors who are, if you ask them, like, do you feel qualified as being a business person right out of school? And almost all of them say no. 5 years
Right.
out, they still don't. And
Right.
even 20 years out, a lot of doctors are like, I'm not really good at the business part of it. I have my CPA do it. My attorney does their stuff. My malpractice people do this stuff. I have other people do it for me. Who of them are really qualified to educate on hygiene? Right? Like,
True.
uh,
Yes.
they
good
have
point.
a small amount of perio in their curricula, which is fine.
Okay.
Their diagnostic, which is why AI needs to come in and help, like with Alabama too. But like having, we just had an episode where it's like, you have a third opinion. You have a hygienist opinion, you have a doctor's
Doctor's
diagnosis, and then you have like software that can help you
Yes,
read all of this
AI.
information,
Yep.
right, and make sure that we're doing the right thing. But like, a lot of them aren't really qualified to be educators. So that whole preceptorship thing doesn't really make a lot of sense for that scope of practice, unless you have such a narrow scope of practice where it is a two-scraper. You know, like it is this is literally all
But
you're
I
doing.
think
I'm
that's
checking
what they're
calculus
using
check.
for in Alabama. I mean, come
Probably.
on. And, you know, it's Alabama.
But how terrible is that, though, when we want to have reciprocity? They're going to all hate you. It's
I know they are.
Misty.Mattingly at... No, I'm just kidding. But we want
That's
reciprocity.
okay. Me and my family, we could probably fit in Alabama just fine. My country
accent.
bumpkin with the accent. You know, I fit in just fine.
We want reciprocity, right?
Yeah.
But we're not all being taught the same thing, to your point. We're not holding everyone to the same thing. And so now that you guys have such a high standard in Georgia with local anesthesia, you want someone from preceptorship to have reciprocity in Georgia? That doesn't make sense to me.
Well, and that's why, you know, we're actually requiring that because every state has different hours, right? Like, so for instance, Tennessee might have, 30 hours they have to get. We have to have 60. So we are requiring that they have to finish up, the hours. So there's going to have to be other programs that aren't even created yet.
Yep.
That will be like a completion program to kind of to do that. So then that way, everybody who's providing anesthesia in the state of Georgia will have to meet the same standards and pass, the same, training.
Are you concerned that you're going to get backlash that you guys are over training, over preparing, asking too much?
Yeah, I think we already are getting that.
Good. But rightfully so.
Understandable.
and
we went through the same thing in Pennsylvania and New Jersey as well. Yeah.
Yeah. I think how many hours do you guys require there?
So I'm trying to remember the exact number because it's off the top of my head.
I have it on this computer.
Yep. So you probably know better than me because I only taught the pharmacology portion, but I still had to do 16 hours of pharm.
Yeah.
In that initial training program. That was a whole weekend just of pharmacology, just going over health histories, going over medications, going over anesthesia. And I didn't touch on accuracy, I didn't touch on technique. It was just the agents themselves.
Right.
And then they underwent another full weekend of just clinical, learning injection techniques, injecting each other. It's grueling. Some of the other programs actually spread it out over more weekends, 2 or 3 weekends, because it's just too much to be able to learn at once.
Ours was in our curriculum in school. Like, that was part of our courses.
Right, exactly.
And so it was a little bit easier. We didn't have to, cram it in on the weekends.
Well, and I think that's the best way to do it,
It should
right?
be,
I think that's really the best way, and our schools will get there in our state. Right now, they're not. So, but, you have hygienists that want to start, anesthetizing their patients, and so, we'll have that. The other thing in Georgia that I didn't like that got changed right as it was being voted on, and it was like, oh, do you go with it or do you not, is they made it where they can only anesthetize only hygiene patients.
Yep.
And that one just really, because I think that there's a benefit for, for hygienists to be able to help, because the doctors are bouncing around the workflow. They're bouncing around so much.
Yes.
We're waiting for an exam. We go and anesthetize for the extraction for doctor.
Correct.
By the time doctor's ready, they do that.
I think it would have helped build that relationship between the doctor and hygienist, right? And I feel like we missed that boat there. I hope eventually we'll go back and maybe get a change there, because I don't think for like the workflow of the whole office and the care of the patients, it's probably the best thing to say only in this. And then too, I think it leaves the ability for people to do things maybe unjust, like, oh, well, we'll put them on the hygiene schedule so then we can anesthetize them. You know what I mean? I just think
that happens.
That is an interesting little loophole.
But I just think about like that would be a way that people could maneuver that, versus if you just said, hey, look, this person can anesthetize, because does it really matter if they're a hygiene patient versus if they're,
is there a definition of what a hygiene patient is in the law?
No, it just says hygiene patient.
Yeah.
But that's what I mean. Like there's ways to get around it. Not that, I know of anybody doing that, but I just think that like because doctors want their hygienist to be able to anesthetize, because once they allow their hygienist to start anesthetizing, and what I have heard from doctors is, I love my hygienist to anesthetize my patients. Matter of fact, I was talking to a pediatric dentist, and she said, when I was in like residency, hygiene did all my anesthesia. I didn't do any of it.
Yep.
And so she was like, I really want hygienists to be able to do it in my practice. And I was like, oh, I love that.
Well, I will say that, when it comes to workflow, it's outstanding, because you really can have your staff now direct the hygienist and the dentist into the different operatories and follow a workflow that you normally wouldn't get, because, as you said before, Andrew, it's stop and start. Doc comes in, gives you anesthesia, doc walks out, hygienist. But here's my problem. Some hygienists that I've spoken to said, I'd rather not anesthetize the doctor's patients. I like my patients, and I know them very well, and I will anesthetize them. But once you ask me to start anesthetizing the doctor's patients, I don't know that patient as well. I have to do more research into medical history. to feel comfortable. And to be honest with you, I'd rather not. And I get that point of view
And
as
I
well.
get that
good
point of
point.
view
Yeah.
too. And I think it doesn't need to be for everybody. You
Right.
know, I
Exactly.
think everybody needs to do whatever they're comfortable with.
But to your point, what is the definition of a hygiene patient? If I'm a doctor and I'm looking at this, well, okay, I'm going to have to pay. I'm going to make sure that my patients who need both services are going to see the hygienist first. They're going to get their anesthesia from the hygienist, and then that's one less person I have to anesthetize. So I see that working that way too. So, in my opinion, I think it's good that it's there. Good that there's some proviso for that. But I think that can easily be used to every practice's advantage. Like you said, it doesn't have to be everybody.
Correct. And the same with anesthesia. Like, you know, some hygienists said, hey, I want anesthesia and they want to do it. And there's some that don't.
Yeah.
I think that's perfectly fine if it's not something that you want to do. But I definitely think it's within the scope of our practice to be able to anesthetize our patients. And it's something that we should be allowed to do. You know, I hate the fact that we've had all these, you know, these states that have been behind, because Georgia has definitely been one of them. You know, Texas being that they just got anesthesia. We have Delaware. Well, I have no idea where they're at. You're up on that side.
Yep,
Like,
nothing
where
yet.
are they?
Zero. No, absolutely no movement on it. But let me ask you this. So in Georgia, are there regulations in place that say the hygienists cannot do certain injections, or can they do all the injections?
They can do all the injections.
Maxillary, mandibular, doesn't matter.
Yes.
Okay, so here's my other point on this. A lot of hygienists have said to me, I would like to inject the dentist's patients, but here's the problem. Sometimes I'm not allowed to do that injection, right? Because the law in that state requires they can only do certain maxillary, not mandibular injections. Or I'd love to anesthetize the doctor's patients, but the problem is I would not use that anesthesia in a hygiene patient, or that amount of anesthesia in that hygiene patient. But now I have to use that anesthetic I'm not comfortable with or not familiar with in a dental patient, and in a volume I'm not used to using. And a good example of that is Marcaine. You know, we don't typically use that in hygiene because it lasts so long. But if you're anesthetizing the patient to undergo a rather lengthy procedure for that dentist, yeah, you might end up using Marcaine and not really have a level of comfort with it.
I mean,
Agreed.
I get
devil's
that.
advocate on that one, though. I don't know a lot of practices that use Marcaine generally. I
Generally,
mean, even
exactly.
for
Yeah. I was
you know,
fixing to say,
extractions and
that's
stuff,
an
it's
odd
just
one.
so.
Yep.
But I mean, that's a great. I mean, that's a great example
great call
of
out.
people not feeling comfortable with it. Well, I think what you're saying is, because I think Texas's rule now is infiltration only, no blocks.
Correct. Like New York
Which
was.
does take a lot of,
Yeah.
you know, I think South Carolina, I think Michelle used to always
Yeah,
talk
South
complain about
Carolina
that.
is just is only infiltration.
Yeah, and that makes it hard to help a doctor out. I mean, I think there's kind of ways
It
around
also
it.
makes it hard to do a scaling and root planing, because you want to stick the patient multiple
I
times.
know, seriously.
I mean, it's kind of like versus just do a block, be done with it. It's more comfortable for the patient, and that's what I always look at is what's best for the patient.
Yeah.
Agreed.
I love being able to help the doctors out, though. I can't. I'll always be an advocate for blocks infiltration, all anesthesia, all procedures. You as a hygienist, if you're licensed for local anesthesia, it's all encompassing. You don't get to say, "Oh, I'm only good for CPR for adults." Like, you have to do BLS for
right,
adults
right.
and children. You're never going to see an infant in your chair, probably, but you have to be qualified for that. So for local anesthesia, I think that you need to the 80%. You need to be at the top of your scope of what's allowable. In my opinion, too, is if even if Texas, if their curricula teaches them blocks, even if the law doesn't allow them to do it, I'm not really sure if that's legal, but then they would be on the same playing field as everybody else as far as education, as far as foundational education.
Well,
And that would be great.
well,
But since they're
remember
not,
that all schools are CODA approved. So that means that the education taught in every hygiene school, because of national board, always teaches up until insertion, right? So they have to learn, you know, the nerves,
landmarks
the
and all that stuff,
landmarks.
yeah.
They have to, you know, learn all the framens. They have to go through all that head, neck anatomy.
Right.
Because that's on national boards. So all of them are getting a lot of that, right? But when it comes to the hands-on piece, they're only going to learn infiltration,
That's-
or they're going to earn all the blocks or mandibular, whatever
Right.
their state allows them to do.
And that's what happened in New Jersey. In New Jersey, initially, they only allowed hygienists to do certain maxillary injections, but not all of them. And then when they changed the law, all those hygienists, not just the ones that went through the certification after they graduated, but ones that graduated with the certification, had to go back to take another certification course to learn those injections. So in a way, to your point, Andrew, it would be great. I don't know if it's legal, but if the curriculum could allow the hygienists to learn all of those injections, then if it passes later on, at least they can say they have some level
Right.
comfort, some level of expertise in that.
And if they
Well-
want to get licensed in their state, then by credentials of their 60 hours in school or whatever, it's already to the top of where it is. All the states will accept it.
Yep.
So they'll be able to get licensed in their state much easier if we have our baseline education there. Sorry, go ahead.
No. I mean, like I said, I think that baseline education is there. I just think that injection piece, and I think too that I'd love to see. Sure, you guys probably know about the safety needle. I think that right there would be a great way for the schools to kind of teach as well, even if they're not allowed. I mean, I'm saying to utilize it to help with training.
I mean, for landmarks, but the thing
For
that-
landmarks.
The problem with mandibular injections is it so varies by the patient, and
It does.
You need so many hours of hands-on to be really able to get it. And honestly, even in my first year, I didn't quite understand when someone had a flaring jawbone. Like I didn't understand how to adapt and get deeper and higher to be able to, you know.
Right.
And so the safety needles don't allow for that, and that's kind of my problem there. It's
No,
like,
but I'm saying for in an educational setting, if you're not able to actually inject, I think that utilize them just to kind of show them placement and things like that would be
It's a
helpful.
good first start,
It's
yeah.
a good first start
Yeah.
because what I'm saying is like in schools where they're not allowed to actually do injections, and now, in all honesty, we only got Delaware left,
Yeah,
and
yeah.
Mississippi, I guess, is kind of finishing up. They're actually learning in the school. They've been doing a program there for a couple of years in the schools, you know. But I'm just saying, like where. And I guess this is null and void anymore because we can all do it. But I think that would have been helpful to,
yeah.
you know, to kind of to put a visual to it too when you were training.
I think my problem with CODA accreditation and stuff like that is they do have like this. Here are like you have to meet at least X, Y, and Z.
Right.
But
It's a minimum
the
standard.
problem is then you have, and this is like a way much bigger conversation that I'm sure our audience is tired of me talking about. But then we have like, okay, and I don't know what New Jersey does, but we'll just say take New Jersey, for example. If it's 30 hours of, 30 clinical hours, in school or whatever that you're supposed to get, well, maybe New Jersey's like, look, we want our people to have 55. Well, 55 is way different experience level.
Oh, yeah.
It's almost twice the experience level of someone that's doing the CODA standard. And so saying that someone, if you're CODA accredited or CODA trained, it doesn't mean anything to me. It really doesn't. It
Yeah.
means that you were taught to the very bottom of the ability.
You were taught to be able to pass a board.
Which is minimal competency. That's what a board says. A board says as long as they're minimally competent, as long as they are not hurting the public, as long as they're not doing these things, which, sure, I guess.
But come
Is
on,
that what you
I
want
mean-
as a colleague, though?
Yeah, but
That's not what I want as a colleague. I want someone
no.
that's going to be good.
But my point is like, where does your education really start? Like, I get, like, you get educated in school and you have that, but, like, where you really get, like, is when you get out in the field. So, I mean, you got to have that
Kinda.
baseline education, right? And you have to, but I think that, like, once you get out and you're really working, has nothing to do with local. I'm just saying, just in general, they learn so much more getting into practice.
For sure. But I think in school you do, I think, depending on what your requirements are, again, if you're the
Yeah.
bottom of what CODA asks you to do, you do get a lot of experience. I felt comfortable being in the depths of a sulcus in school. Now, had I seen everything? No, obviously, because we're doing easy stuff in school compared to what is out there in the world. But, local, I think, is just a whole different I don't know. I'm
No, it
protective
is.
of local, I think,
Yeah.
a little bit too much.
Well,
But,
it's probably the one thing that hygienists do that's probably the most life-threatening.
yeah.
Right, when you
It
think about
is.
hygiene procedures. And I think, and I mean, I could be wrong on this, but I think reciprocity is going to drive this process. I think when some states realize, okay, we're going to be providing reciprocity, we'll be part of this new movement, they're going to raise their standards to some extent because they're going to want to know that any hygienist coming in their state is as qualified as a hygienist that was trained
Yeah.
in their state.
Yeah.
So I think that's only a natural progression. I think it happened in pharmacy as well. So some states in pharmacy, you still have to take an extra board exam in compounding or something like that. But the bottom line is, I think now it's universal. So I see that with hygiene as well. I see that's going to be the next push. But keep in mind also that hygienists go through this program, they really get grilled the entire 2 years. And then when they finally leave, there's almost like this letdown. Like, I went to all this education, I went to all this training, and all I do all day long is the same thing every day.
Yeah.
And that's what, there's no challenge left. But anesthesia provides that challenge.
Yeah.
Like,
I think it helps with
It's a
burnout.
clinical challenge.
There's
Yes,
huge
exactly.
burnout in our industry,
Yep.
and I think that giving the hygienist the ability to do other things
Absolutely.
helps, prevent burnout.
Yeah.
Because when they constantly get out, and I hear that all the time from new grads. Like, I was so excited. I loved hygiene school. It was so hard, and then I get out and I'm just cleaning teeth.
Yeah.
And and I'm like, you can't think of it that way. You have to think of it as you're providing care to that patient and comprehensively and look at them comprehensively and, do other things like anesthesia helps
Yeah.
with that, and it makes them feel too that they're elevated as a professional versus somebody who's just polishing teeth, right? Like
Yeah.
they're
Yeah.
more of a healthcare provider,
Yeah.
and it makes them have that uphold that higher level of standard too,
For sure.
clinical standard for themselves, I
and
believe.
maintains the integrity of the profession too, because in a lot of states there's a slide now of dental assistants. And no, this is no offense to the dental assistants, but there's a slide now where assistants are being given more and more techniques to do, more and more responsibilities, and so it's sort of chipping away at what hygienists can do. And so anesthesia is something that I don't believe assistants will ever be able to do.
I hope
so
not.
That's what I'm saying. So that really establishes the hygienist and maybe elevates them, to your point, into a position where they feel more like part of the team with the dentist and really work hand in hand. And I'm not saying this is bad for the assistants. I'm saying everybody has their lane.
Right, and I think that I'm an advocate for dentals. I was a dental assistant for 8 years before I went to hygiene school. So I'm a pro dental assistants. You know, we can't do that. You can't do our jobs without them.
They're the front door of the office.
They're the front door, yeah.
Absolutely.
But what I don't like to see is that we're trying to give dental assistants more duties and more responsibilities, and I think we do need to, grow that. But I think there needs to be some education, and also I really do feel they need to be registered. Because the states don't register dental assistants usually, and I think as we begin to give them the ability to do fillings or different things, right?
Yeah.
That we need to have the ability to discipline them as well. And right now we don't have any way to discipline dental assistants. And if we're going to give them the ability to do more, we need to be able to have some oversight.
Well, that's the thing. In my courses, I'm always talking about taking blood pressures, taking medical histories. And hygienists, you almost unanimously, and dentists say, Tom, we don't have freaking time to do that. I mean, how much time do you think we have in an appointment to take medical histories and take blood pressures and vitals? That's 20 minutes out of a 45-minute appointment. What time do I left to do the actual procedures that I need to do? And that's why I say, okay, well, we'll delegate, get assistants involved. Because assistants can pick up part of that slack. But you're right. They've got to be trained to do it, number one. And number two, there's got to be some accountability, because if it's your hygiene patient and that assistant is taking that medical history, ultimately you're responsible for that hygiene, that assistant's work in hygiene. You've got to be able to have some authority over that person.
Well, exactly. But what we're also seeing in our state is like DAs, and I think everybody's, but a lot of DAs like doing ortho procedures and things like that. And like, it's just a slap on the hand because we can't take their license, right? Or we can't.
There's no license. Yep,
there
exactly.
is no license.
Right.
So that's why I'm saying if there was a way to have them registered, some way to track them, and I'm not worried about it could be a minimal fee to have them registered, but we have to have some type of authority over them as well.
And when we say we mean like dentistry as a whole. Just for all of our audience, not hygienists. I just don't want authority over.
No.
We're talking about as dental professionals.
I'm talking about as dental professionals
And from the state
as
board
from a
and-
state level,
Yeah,
right?
yeah, exactly.
Like whatever state they're working in, we should have some oversight. If we're going to give them the ability to do some of these extended services, because in some states, I think Pennsylvania, can dental assistants do fillings and things?
I can't think if that's true or not. I'm so involved in teaching hygienists, I forgot what the assistants are
I
allowed
love
to
that
do.
you're involved in teaching
Well,
hygienists.
I love it too.
He
It's
loves
my
hygienists.
my favorite thing in the world. I always talk them up, and I always make sure that people understand. I will tell you one other quick fact. I do speak for medical professionals and nurses because of the nature of pharmacology. They have no idea what hygienists and dentists do. And it's unfortunate because what happens is ultimately they don't know what dentistry allows and doesn't allow, and they don't know how to make that work as far as, okay, I really wish I knew more about what a dentist and a hygienist does. And I always tell them, if you want to know what a dentist or hygienist does, spend some time with a dentist or hygienist and watch what they go through every day. Watch what it's like to be a dentist and a hygienist. And I almost want to say watch really a hygienist, because they're the ones that manage a really large workflow and are very efficient and very timely in their ability to manage their own time and their own tasks. I'm not saying dentists don't do that. I'm saying that hygienists they live and die by the clock.
Oh,
and
absolutely.
So medical doctors, as I'm sure you know, if you've been to a medical facility and had a doctor's appointment, you could sit there and wait, for 30 minutes sometimes for the doctor to walk in the room. But that doesn't happen in hygiene. You're in and out, right? Because it's unless there's like after COVID, it was pretty bad and there was a backlog. But I mean, for the most part, I'm in my hygienist chair within 10 minutes of walking in the office.
No.
So to me, that's an amazing thing. And I think I've often said that to medical doctors and nurses, you can learn a thing or two from spending some time with a dentist or hygienist. So I hope they realize that that's meant with love.
Yeah,
right?
no,
Because we love our medical sisters and brothers as well.
Right. And I really think that we'll see more medical dental integration too. I think we're really at the start of that as well.
And I think, well, you've seen it in the oral systemic connection. You know, now we're starting to see docs be more aware of how important it is to have good oral care and good oral health as it relates to systemic health. But now we've got to do our part and see it the other side. Say, okay, so we're so focused on oral, we sometimes miss the systemic. They're so focused on
Absolutely.
systemic, they miss the oral. And my point when I do my courses is, because I'm the outsider looking in at the whole thing, is trying to marry everybody together and say, you got to walk down two sides of the street. You've got to know every drug you use in the practice of hygiene and dentistry, because it could impact systemic health, but at the same time, you got to know every drug that people use for their systemic health, because it may have an impact on dentistry and hygiene. And I think that's right. That's oral, that integration that slowly, grudgingly is taking place, over the last 20 years.
Yeah.
So, Tom, let me finish with this, and we probably should have started with this question. Do dentists have anything to be concerned about with hygienists doing local anesthesia?
I don't believe so at all. I think, if anything, I'd be much more comfortable knowing that a hygienist is administering anesthesia, especially to all patients I would consider as a dentist. These are all my patients first, right? Mm-hmm. I would have no problem having a dentist administer anesthesia, but what I would ask every dentist to do is, if they had a problem, if they had a doubt, if they had a concern, get in the chair and have the hygienist anesthetize you.
Yeah.
And you'll be proof of concept right there, right? If the hygienist knows what he or she is doing, hey, you can have confidence. But if you're just going to go on, they received their training, they received a certificate, I guess they're okay. If you've got that doubt in your mind, get in a chair, let them do it.
Wow.
I love that.
Well, it's a good thing we didn't
that.
start with that, because that would have been like a 2-minute episode. So, Tom, thanks as always for being on. We're going to have you on lots in the future, I'm thinking. So I can't wait for that unveiling soon. If someone wanted to reach out to you, how is the best way for them to reach out to you?
Website's the best, tomviola.com, or social media everywhere at Pharmacology Declassified.
Appreciate you, man. Thanks.
Thank you, man. Hey, I appreciate everything you do for this profession, Andrew.
I
Thank you so
know.
much.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.